Continuing our coverage on that mental health crisis, more families across Western Oregon are struggling to get food on the table, and local organizations are stepping in to help, including one called Youth Era.
All right, so we got some food options here for our youth to come in and access.
This week, what they call their Eugene Drop location was filled with food to give away to kids in need. Hunger is no doubt contributing to the mental health toll on so many people during the coronavirus pandemic. Youth
Era founder and CEO Martin Rafferty is joining us live again with an update on your efforts to help at-risk youth here at home and across the country during this incredibly stressful time. Martin, good morning. It is the third week that we're checking in with you, and you continue to see the need for food grow.
Yeah, we have essentially turned all of our direct service centers into places for youth and families to come and get food. And these aren't the traditional families that are in need of these kinds of services. These are middle-class families who are now trying to figure out anything to make ends meet.
And Martin, Youth Era has helped more than 1,000 youth across social media just these past few weeks. And you've seen a lot of attention on Youth Era's Twitch platform. Now, what can you tell us about that, including what Twitch is for viewers who don't know and how you're using it during this pandemic?
Sure. So Twitch is a novel kind of platform. For anyone my age and older, it's kind of hard to understand. But if you can imagine, it's kind of like YouTube, but it combines the things that you love about watching like a late night TV show like Stephen Colbert. You turn on every night to watch Stephen Colbert. With Twitch, when you're logging on to see another young person who's playing your favorite video game. And so they will be talking with you. There's a chat box on the side of the screen. And so there's a lot of interaction. And this is the biggest platform for our age group that we're reaching is on this platform. It's bigger than TikTok. It's bigger than Instagram. Our young people are spending the most time on this platform.
And one more statistic that we just saw on the screen that's very interesting. You've had dozens of governments and service providers, not only here at home, but across the country, reach out specifically to your organization. What for exactly?
And Brian, again, months ago you covered that, we were pioneering in the area of using some of these services. And back then it was a concept that seemed a little far-fetched. Now we have government agencies and organizations across the country that are saying, we don't know how to do digital. We don't know how to reach young people on social media. There are laws like HIPAA, privacy laws that have been revoked because the government is seeing that this mental health crisis is a really big threat. That it's not just the physical health that's being caused by COVID, it's the mental health issues that are rising. And so they've relaxed some of the privacy laws. And so these agencies and organizations are now struggling to try and figure out how to quickly utilize this technology.
And you guys have been doing that for quite a while. That's what makes your organization unique compared to others. I know Lane County health officials just at the top of this hour in their press conference talked about mental health. We asked them about their focus, and they said they are continuing to focus on it and try to follow what statistics are being put out there. And it's governments like Lane County that are reaching out to you to say, hey, you're the expert here. How can we do this and do it quickly?
When the situation gets severe enough, we start to think about things that we took for granted as the lifelines. And right now, all of these social platforms, all of these social media networks, they are the platform. They are the only way that we can reach some of these youth who literally have no other access into systems. Youth who aren't enrolled in services, they are at home. Teachers don't have their eyes on them, principals don't have their eyes on them. These young people are isolated and alone. And so if they're struggling with mental health, if they weren't before, they are now. And if they were before, if they were struggling with trauma, they were struggling with underlying mental health issues, how much support do they need now? They need more support because all of the other social fabric pieces in their life are disappearing. And so it's crucial that we move quickly and that we transfer as many services as we can to digital that makes sense. There are some services that don't make sense, like food, for instance. And so we need to keep focusing on the health piece, that, health, physical health and mental health should be close to the same level when we're thinking about how we're supporting our families. But there are other economic things that we have to focus on too, making sure that people have food to eat and that they have shelter. I mean, these are things that if we don't start working on them now, in weeks and the months to come, it's going to get a lot worse.
And a great resource, youthera.org, is your website where there's a ton of important information and ways for people to get help. Martin, thank you again for joining us. Same time, same place next week. Be well.
Thank you so much.